From the Toronto Star, I'm Saba Eitizaz, and this matters.
The big question right now is, are countries going to use this time during these shutdown periods optimally? This is guerrilla warfare against a virus. The virus is just going to sit you out, right? It'll just circulate quietly among, households, et cetera. And then you're going to let them all go again. And boom, it'll take.
That was the World Health Organization's Dr. Bruce Aylward. For over a month, Canadians have been keeping their distance to slow the spread of COVID-19. We're not out of the woods yet, but authorities say we might have crested the first wave. But health officials warn there will be a second wave and a third. Meanwhile, we are all asking, how long will this lockdown last?
We have been open and transparent with Canadians on the facts, and I've said from the very beginning that there are a wide range of scenarios that we have been looking for, that we're planning for, that we know that we are going to be in place for a number of more weeks, perhaps more months, but everything depends on how Canadians behave.
There's now already talk of lifting some restrictions next month, but is Canada prepared with the data and the plans for what comes next? And what will an exit strategy look like? Today, I speak to Professor Amir Attaran, a biomedical scientist, a lawyer, and a professor at the University of Ottawa. He was recently part of a cross-border study that revealed COVID-19 numbers are actually much higher than the government has predicted. We discuss what could and should come next in the war against the virus, and whether that's going to be enough. Hello, Amir. Thank you so much for being on the podcast.
Thanks, Saba.
So I'm going to ask you first what you think about where we are at right now. Is Canada's coronavirus curve flattening? What do you see?
So the epidemiological model, which was done with colleagues at the University of California, Berkeley, San Francisco, and in London, that model says, yes, we have passed the peak of infections for the first wave. But is that ever an important caveat for the first wave? As you know, most of us are locked down, sitting at home. And at some point, we will have to get on with our lives and get out of this lockdown. That will trigger subsequent waves, and then we will see infections rise again.
I want to get into that with you. You also mentioned this in one of your articles that this is playing out in waves, and we seem to have passed the crest of the first wave, shall we say. What stages or waves come next? What do you see playing out?
Well, that's our choice. That's really the government's choice, is at what point to begin telling Canadians that they may get out of their self-isolation, which people get out, how many of them, at what time. These are all human decisions. They're not driven by the virus. They're driven by our choices.
While you talk about this, the government has also been speaking about the need for the lockdown to be in place for the next few months. And there's also opinions that restrictions might actually become less strict in as soon as a few weeks. Keeping in mind what you're saying right now, is that a realistic assessment?
Well, Saba, you ask a good question, because it's true. We've heard the message that it could be months longer in lockdown. We've heard the message it's weeks longer. Where does the reality actually lie? And that, as I said earlier, it's a government choice. It's not a law of nature. It's not a law of biology, medicine, physics, or anything of that kind that puts a clear start date on releasing people from self-isolation. It's the choices we make. The obvious thing is you'd like to make the choice in a way that minimizes the risk to Canadians. That takes some exquisite epidemiological planning. Imagine if we're not talking about a pandemic. Imagine if we're talking about a hurricane, and the hurricane is barreling in towards the shore from the ocean. It's going to do tremendous damage. We have very good forecasts about where the hurricane is going to hit, when it's going to hit, what sort of damage it can do, and that allows us to give people wise advice on sheltering themselves. And likewise, we have very good data about when the hurricane is passing, or if it's weakening, or if it's changing course, and that advice can change. There are even entire television networks dedicated to this, right? The Weather Channel. we're not seeing anything like that quality or type or even effort at forecasting being made by the federal government.
What do you think is the reason?
The federal government itself has lousy data. And it has lousy data because it's depending on the provinces to provide data about who's been infected, where, how did they become infected, were they admitted to a hospital, were they discharged, or did they get worse and go to the intensive care unit? Did they survive? Did they come out of that intensive care unit alive? These are all fundamental questions that can be posed about each infected person. And that's held by the provinces, but not shared with the federal government in a timely or complete way. And that's because of an absolute failure of federal leadership to build a reporting system that would be quick, that would be accurate, that would move that information from hospitals to provincial ministries of health and then to the federal government. The calls to build such a system and to share that information have been numerous, but they've been ignored. So I think the federal government in the first place is suffering from the fact that it's not totally blind to the data that comes out of the epidemic, but quite seriously hindered in its vision.
You were a part of a study as well that conflicted government forecasts about the rate of infections and mortality rate from this pandemic. And the study concluded that the numbers were much higher than predicted. And it also seems that the number of deaths at over 1,200 is now at least double what was predicted by government modeling projections, at least on the lower end. Can you tell me more about what your findings were in the study?
Sure. So what we found in our study, and it's very similar to what other studies in other countries say, is that it is going to be necessary for something like 50, 60, or 70% of people to become infected before the virus grinds to a halt, before transmission naturally grinds to a halt. Why is that? Well, for most infectious diseases, and probably COVID, although we aren't sure, once you become infected, you become immune and you don't get reinfected, at least for a period of time. There's no immunity, in other words, without past infection. And once enough people have been infected, that 50, 60, or 70%, and become immune, the virus has too few susceptible people left in the population to go on spreading successfully. Most of the people to whom it spreads are immune, and that's a dead end for the virus. So in other words, once you get to a critical threshold where the population has experienced widespread infection and widespread immunity, that's where the epidemic naturally peters out. In contrast to our finding that this number is somewhere above 50%, the federal government, I have to pick my words carefully, but I have to be blunt, probably the least competent epidemiological model I've seen in my life, released that this epidemic could grind to a halt by fall with only 1 to 10% of people being infected. And that simply isn't true. And it doesn't align certainly with our epidemiological modeling, that which we did with scientists in California and London, but it also doesn't align with anyone else's predictions about the virus anywhere else in the world.
So how can we then eventually ease back into normal without endangering lives? What will this path to normal look like for Canada?
There's not any way back without endangering life. None. The only thing you might wish for that could do that is a vaccine. And wouldn't it be great if we had one? But we don't. And we're not going to have one this year. It'll take lots of experimental work and luck, too, to have one for 2021. But the thought of a vaccine in 2020, forget about it. It's not going to happen. It just can't be made to happen on that kind of timeline. Which means that either we all stay locked down until a vaccine comes to be next year, if at all, because there's no guarantee a protective vaccine can be found. I think one probably can be, but nobody can promise it. Or if we don't want to wait that long, and I don't think most of us do, we have to enter the community again in a very carefully planned way, which will not prevent us getting infected. Many of us will get infected. It will not prevent many of us getting sick. It will not prevent some of those dying. There's no way around this.
So what are those stages of entering into the community in a planned way in your assessment?
I can give you a general answer, but in order to give you a really precise answer, I would need that data that the provinces aren't sharing very well with the federal government, and the federal government isn't sharing very well with outside scientists. Roughly, and without the data, this is what it looks like. You'd probably want to begin by letting some, not all, just some people out of self-isolation. Who? Well, likely the ones that are young, that are healthy, and therefore, if they do get sick, because some will, aren't likely to get very seriously sick and aren't likely to end up in the intensive care unit where they might die. Start by releasing the young, the healthy, who are going to be less likely to die. They can do some of the groundwork of getting our society and our economy back underway. There may be other people who have to go to the front of the queue as well because they, say, have a profession, a job that requires them to be there, a very high priority kind of job. We'll have to make some allowances for that too. Once these people integrate and a certain number of them fall ill, hopefully by that time Canada will have the capacity to quickly test them for infection and quickly isolate their contacts so that the minimum number of people become ill. Well, right now we don't have that capacity. Right now, because of years of cuts to public health, because of very poor planning by the federal government for how to respond to a pandemic, we don't have extensive contact tracing labor forces who can do this, and that's a problem.
So with this problem in mind, at what point can you see this start to happen?
I don't know. I would really need to see much more data than the government is making available before I try to answer that question. And the reason I'm hesitating is not because I don't know how to answer it. It's because any answer I might give you, Saba, that's wrong could cost people's lives. And so I think that's a good reason to hesitate. What I would like is that the federal government gets serious about collecting data from the provinces, whether or not the provinces are particularly fond of the idea. If the federal government has to pass an emergency law forcing the provinces to share their data, then do it. If the federal government has to give Statistics Canada the job of harmonizing the data, collecting it in one place, then do it. But get these data in the hands of people who know how to do an epidemiological model, basically a disease forecast, much like a weather forecast, so that in the next steps we take of opening the country up, which are dangerous steps, we take them with a map, we take them with a plan, we take them with scientific guidance. Because if we don't do that, we'll end up killing people by accident.
So there's a number of countries that are already announcing exit plans like Denmark, France, and Germany about how they will be coming out of the lockdown. And the UK is also under pressure to do the same. You're saying that we're not at a similar level of exit planning yet.
Canada has inferior epidemic data to all the countries you've just named. That's the problem. And so with inferior data going in, how do you make a superior plan coming out? You just can't. You'd either have to fly blind a little bit, which I'm afraid our government may have to do because it neglected for years and years the warnings about needing to collect better data during epidemics, decades of warnings, actually. We either have to fly blind to some extent or we have to get extremely serious in the next week or so about getting better data to the hands of the federal government and in turn into the hands of scientists who can help plan a way out of this.
What happens if it's not done within the next week or so window that you're talking about?
Well, you could postpone it longer, but then you'll likely end up keeping people locked down longer than necessary. As we said at the beginning, Saba, I mean, we've passed the crest of the first wave. Now's the time to be thinking about how to drop some of our isolation and how to get back to normal life. And I don't think it's particularly good for our society or for the economy or even for the mental health and well-being of Canadians to keep them locked up longer just because the federal government and the provinces can't dance together on the data. That's a really bad reason to ask people to go without a paycheck or to stay indoors or to try and homeschool their kids. Or, there's even worse things going on. Domestic abuse is probably up. We need to be planning how to get out of this fast, efficient, and as safe as possible. And for that, by God, we need better data for better science.
So you're saying it all boils down to a lack of standardized data, basically.
That's the first step. And then you have to start posing questions using that data and using epidemiological models of which people can go out first, which age groups, or which people with which pre-existing disease conditions. Can the diabetics go safely? Can the people who are immunocompromised go safely? Could the elderly go safely? Could schools be opened safely? Now, when I say safely, as I explained earlier, that doesn't mean with no risk. No, people will get sick and some will die. But the question is how to minimize the deaths. That's where the models can help you. And that's where the data is necessary to make the models work.
And what will be those indicators? How will we actually know when it's time to reopen the country, essentially?
Well, most epidemiological models use as their inputs things like the number of people who have been hospitalized for COVID, or data on how long it typically takes from the time a person is exposed and becomes infected to being hospitalized. You can measure that in days, and that feeds into the model. Or how many people each infected person is likely to spread the infection to. In other words, how quickly would the epidemic grow without measures to control it? These are the sorts of numbers you feed into a model, and in turn, it gives you predictions about the future. Just like for a weather forecasting model, you feed in what's the direction the wind is blowing, how fast is it blowing, what's the temperature of the surrounding air, are there physical features on the ground like tall mountains that get in the way of weather systems. These pieces of data go into making a weather forecast, and similarly, there are data that go into making a disease forecast.
And you're saying at this point, Canada is much further on this than it thinks.
Canada is very far behind, very, very far behind. And can we talk a little bit about the missed warnings here, Saba? I think that's important too. 3 times the Auditor General of Canada has warned that our country was poorly prepared for a pandemic. And the Auditor General also warned that a big problem was the lack of data sharing that would be necessary and systems to make the sharing work fast and efficiently and accurately. So those warnings were there 3 times from the Auditor General. And then SARS as well happened in 2003, and that was a disaster. Well, after SARS happened, the federal government brought together some of the best thinkers at the time and said, give us recommendations of what we need to do. What are the lessons we've learned? And one of the leading recommendations out of that 2003 report that the federal government itself published was, we need better data sharing and we need it to work. And if the provinces won't cooperate and we can't do it cooperatively, then Parliament should pass a law to make the data sharing legally required, make it mandatory. That was 2003. We're 17 years later, and that was never done. That's why we're in the mess we are.
Thank you so much, Professor Amir. You've been very kind with your time.
Thanks, Saba.
That was Amir Attaran, a biomedical scientist, a lawyer, and professor at the University of Ottawa, speaking to me about what comes next for Canada amid the coronavirus crisis. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Saba Eitizaz, Adrian Chung, and Raju Mudhar. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.